Welcome to IDD Awareness Day and the IDD Policy Webinar. My name is Dina Johnson, and I'm representing Dr. Sandra Friedman from JFK Partners. First, let's start with some housekeeping. All calls are muted. Please use the Q&A box for questions throughout the meeting, and we're going to do our best to answer those questions at the end of the presentation. We have enabled closed captioning at the bottom for today's webinar, and you can turn that off if you don't want it by clicking on the live transcript button. The PowerPoint and the IDD bills referenced and the bill talking points, along with a recording of today's presentation, will be posted on the Alliance website and the IDD Awareness Day page. So before we begin, we would like to take a moment to send our condolences to the victims, survivors, families, friends, and the entire Boulder community impacted by Monday's shooting. Many lives were taken that day, including a person with intellectual and developmental disabilities. The sponsors for today's event are the ARC of Colorado, Alliance, which is the nonprofit association for community-centered boards and program-approved service agencies serving more than 20,000 people with IDD in every Colorado county, and JFK Partners. Today's presenters are Josh Rail, who is the Executive Director of Alliance, Ellen Jensby, who is the Senior Public Policy and Operations Director, and Cristiano Sosa, the Executive Director of the ARC of Colorado. During today's webinar, we plan to cover an overview of COVID relief in Colorado, the Roll Up Your Sleeves vaccination campaign, and some IDD bills to watch at the Capitol this year, and the End the Wait campaign. I will now turn it over to Josh from Alliance. He and Ellen will be covering our first topic today, COVID relief in Colorado.
Good morning, everyone. Thank you for joining us. As Dana said, my name is Josh Rail, and I'm the Executive Director of Alliance. During the unprecedented events of 2020, the Colorado IDD community came together to do all that we could to keep people healthy, safe, supported during a really difficult time. We are also grateful for the leadership from the Colorado Department of Healthcare Policy and Financing, the Colorado Department of Public Health and Environment, our advocate partners, CCBs, PASAs, parents, researchers, self-advocates, and of course, legislators for making our community a top priority during this pandemic. This excellent leadership placed Colorado at the forefront among states in its efforts to stabilize community services for people with IDD and their families. As a result of this leadership, Colorado's IDD community has experienced incident and mortality rates dramatically lower than other states. Out of over 14,000 people served in Colorado on our IDD waivers, only about 2% of them tested positive for COVID. And unfortunately, we have seen 16 deaths. Colorado was featured as one of the states that got it right in the 2021 National Case for Inclusion report. We have linked that report to this PowerPoint if anyone is interested to take a look. One of the main reasons that Colorado's network of community-based services for people with IDD is faring well compared to other states is because of the swift and decisive actions taken by the state early in the pandemic. Many of these steps Colorado took are outlined in this next slide. If you can advance that slide, please. From the beginning of this pandemic, on March 13th, 2020, the state quickly issued retainer payments, which helped ensure people can continue to receive supports during the pandemic and that people with IDD would have services after the pandemic too. These retainer payments kept people employed, businesses open, and gave people the resources to transition into the new virtual world. The Colorado Office of Community Living quickly asked the federal government permission to offer telehealth, remote supports, and flexibilities needed to access services and reduce the spread of the virus to the staff and to the people they support. There were also several temporary rate increases offered to cover costs for increasing staff, PPE, and other expenses. The state created a new 3-tier rehabilitation structure that now allows one-on-one services with an individualized budget. This is a great person-centered choice for a service that will last beyond the pandemic. Because the normal way of providing services drastically changed, the state quickly responded to provide trainings for frontline workers and guidance for agencies serving our population. However, the state wasn't the only place where people received COVID relief. Ellen, would you be able to tell us what supports we received from the federal government?
Absolutely. So both a state and federal approach to addressing the impacts of COVID was necessary during this past year. One of the first things that our members of Congress did on the national level was issue stimulus payments to individuals and families, including people with disabilities, and made sure that those stimulus payments would not affect their access to benefits. So that was an incredible step forward. Additionally, they passed laws that protected people's Medicaid enrollment throughout the public health emergency. So this disallowed states from removing people from Medicaid enrollment during this period, except in very limited circumstances. They also issued increased funding for special education and safely reopening schools. They expanded small business loans to help retain and pay staff, such as the Paycheck Protection Program. And these were really critical for many of our provider agencies who experienced financial impacts of the pandemic as well. They also created a federal provider relief fund, which providers could apply to help them cover expenses and losses related to COVID. Another huge step forward to helping fill those gaps experienced by providers and helping to keep staff employed to support people. They also expanded paid leave for COVID-related absences. And they also allowed employers to claim tax credits to help them cover the costs of that additional paid leave for employees. Again, another important step, as many of our direct support professionals were experiencing increased exposure to the virus and potentially having to stay home with children as schools closed or as they themselves or their family members became ill with the virus. They also, in this last funding package that they passed into law, they issued funding for state and local governments to help them fill budget gaps. So with the extreme unemployment that we saw and the loss of jobs over the last year, state budgets really took a hit, as well as local budgets, because of the decrease in tax funding that they could bring in from the public. So this was another important step to make sure that states didn't have to make drastic cuts to disability services. And finally, they issued temporary increases in the federal Medicaid match. For those of you who may not know, there is a state portion of Medicaid funding, and then there's also a federal matching portion. Colorado split on that is about 50-50. So for every dollar that our General Assembly puts in for Medicaid, the federal government matches that by about another dollar. But during the public health emergency, states got an additional 6.2% federal match to help them cover the expanding Medicaid rolls as people lost their jobs but needed to maintain health coverage, et cetera. And then in the most recent COVID relief package, Congress acted in an unprecedented way by issuing a 10% federal matching bump that's dedicated to home and community-based services for people with disabilities. This is the first time in history that a federal matching enhancement has ever been dedicated to our population. This 10% bump will be effective April 1st and continue through March 31st of next year. And we, as well as our partners and our state officials, are currently looking at all of the different ways that that funding can be used to support individuals and families with disabilities, as well as the provider network that supports them over the coming year. So it's a very exciting development that's never been done before. With that, I believe I'm passing it back to Cristiano.
Well, thank you all for carving out the time. I know how incredibly busy people are, and we have a lot of good news to share. And I have the privilege of talking about the Roll Up Your Sleeves campaign. As many of you know, it took really a village to prioritize people with IDD, their caregivers, and direct service providers in the vaccine schedule. And it took all of us to make that happen. So now that we're prioritized, where do you get a vaccine? You know, we are suggesting that you reach out to your local ARC chapter, your community-centered board, your service agency, and your local public health department. The CDPHE has really done a great job in terms of the compendium of resources and including Vaccine Finder. And you can find more information on the Alliance website as well as the ARC of Colorado website. In terms of eligibility after that intensive advocacy, we are currently in phase 1A and B4. Anyone living in an IDD group home and community-based providers, anyone over the age of 50, and people with one of the approved high-risk conditions, which include people with Down syndrome, people with disabilities who require direct care in their homes, and people with disabilities that prevent them from wearing a mask. If you click the link here, you can see the list of all of the high-risk conditions. And I am turning it over to Ellen.
Actually, you're turning it over to me, Cristiano. So although every year there are hundreds of bills introduced at the Capitol, this year, this webinar is going to focus on 4 that have direct impact of people with IDD and the agencies that support them. So on this slide, and also on the Alliance Awareness Day webpage, we have links to the bills and talking points for each of them that we will cover today. So first, Ellen and Cristiano will cover, they will cover them in more detail. So Ellen, would you like to take it away for the first couple?
Absolutely. I can get the next slide, please. Thank you. So the first bill we're going to talk about today is one that's related to eliminating sub-minimum wage employment in Colorado. I'm sure many of you who are attending this webinar have been well aware of the ongoing conversations for many years about sub-minimum wage employment for people with disabilities. This particular bill is actually sort of the brainchild of the ARC of Colorado, as well as Disability Law Colorado, our state's protection and advocacy agency. They approached Alliance in late 2018 with this as a bill concept, and we partnered with them over the course of the next year to come up with this bill concept. It was introduced last year, but unfortunately, due to the budget impacts of COVID and the need for our General Assembly to look at priority bills that addressed those needs, this bill was unfortunately not passed last year. So we've brought it back again. Its bill number is Senate Bill 2139. And for those who may not know, federal law is what allows people with disabilities to be paid below the minimum wage. And there are approximately 400 people with intellectual and developmental disabilities earning sub-minimum wage in Colorado today. However, Colorado has proclaimed itself an employment first state, which means that we promote competitive integrated employment. And we have had a number of bills and initiatives over the years to try to get us moving more and more in that direction. So this bill does a number of things. First, it would close the front door on new sub-minimum wage programs and hires. So from This summer on, no additional agencies will be able to apply for a federal 14C certificate, as they're called, or hire anyone new into a job at subminimum wages. For those who are currently working in subminimum wage jobs, it establishes a 4-year transition timeline to give them time to successfully transition to better jobs and services. It also requires the subminimum wage employers who are currently operating these programs to develop robust plans to transition away from subminimum wage to other programs and services. And in order to help people successfully transition, it enhances Medicaid services to support those outcomes. So a few of the things that it would do is expand the Medicaid buy-in program to the developmental disabilities waiver and enact a new benefits counseling service within the IDD waivers, to allow people to work more and earn more without losing access to the critical benefits that allow them to do so. And finally, it tasks what's called the Employment First Advisory Partnership to develop recommendations to address systemic barriers to competitive integrated employment. We know there are many systemic barriers to people achieving their ultimate employment goals. And this bill doesn't address all of them, although it does attempt to address many. But we are excited about the additional recommendations that we can all work toward as a community to reach our employment goals as a state in the future. Next slide, please. The next bill I'm going to talk about is sort of vaguely referred to as Medicaid transportation services. So the background on this one is that there's an existing permit process through the Public Utilities Commission for transportation providers of Medicaid services and, providers of Medicaid transportation services, if I can say that in the correct order. Those transportation services include non-emergency medical transportation and non-medical transportation provided to people with disabilities. And although those permit requirements have existed for certain Medicaid providers for several years now, we learned this year that they will newly apply to transportation for people with IDD this coming summer. And these requirements have financial and administrative costs that will, we believe, limit transportation options for people with IDD and therefore limit their access to community integration, their ability to get rides to their jobs, to day programs and other community activities. So this became a big concern for us over the summer. And we have worked closely with our partners at the state to develop this bill concept. So the summary of the bill is that it will eliminate the Public Utilities Commission permit requirements for Medicaid transportation. And instead of them being seated under the PUC, as we call it, it'll move oversight of these services to the Department of Healthcare Policy and Financing, which for those who may not know is the department that oversees all Medicaid services already. And in order to create this new process, it requires HCPF to work with stakeholders to establish rules that ensure passenger safety while minimizing the financial and administrative burdens on provider agencies, staff, family caregivers, et cetera. So we're very excited about the positive impact that this bill will have in not further limiting transportation options for people, especially as we've seen those so limited due to pandemic restrictions. And the resulting financial impacts on agencies have been very significant. With that, I'll turn it over to Cristiano to cover his supported decision-making bill. Cristiano?
Thank you, Ellen. As you can see, it's an exciting time at the legislature during the legislative session with some really significant changes that will improve the outcomes of individuals with IDD. And I feel that the supported decision-making agreement certainly falls into that mold. We're very excited. 10 states have adopted supported decision-making agreements. 30 states are considering this now. And what a supported decision-making bill does is it allows an individual with disability to voluntarily enter into a supported decision-making agreement with someone they choose to support them. And part of the reason for this is that many caregivers see guardianship really as the only option to ensure the safety of their loved ones. We see this particularly in the transition age from youth to adult. A second point is that people with IDD, and I think I'm speaking to the choir here, are often capable of making decisions about their lives when they're supported to do so. And this bill really lifts that up. Guardianship, as we know, is the most restrictive option and often strips people of their rights to make their own decisions. In summary, the supporter helps the person understand their options, collect and understand information about the decision, and assist with communicating decisions. You can find more in the talking points. It's a brief overview here by clicking the link or jumping onto our website. Next slide, please. And this is another bill that has been really decades in the making and really started in 2014 with a study that was commissioned by several folks who are participating today. We established some pilots that had some very high success rates in terms of making it easier in terms of access for folks who are experiencing crisis situations. And these pilots provided some really good data that helped to inform the bill that's in front of you now. The bill summary directs the Department of Healthcare Policy and Financing, lovingly known as HCPF, to work with a training vendor to provide training to case management agencies, mental health centers, IDD providers, professionals within the school system who are trained and equipped to deal with folks who have dual diagnosis, which is intellectual and developmental disability and a co-occurring mental health challenge. We hope to provide training up to 30 providers throughout the state, minimum of 20, with an emphasis and a focus on underserved areas. Ellen, I'm going to give it back to you.
Thanks, Cristiano. So in addition to these 4 bills that we wanted to cover in a bit more depth, there are a number of other bills related to IDD services and people with intellectual and developmental disabilities moving their way through the General Assembly this year. And here's an additional few that if you'd like to get more information on, you can look up yourselves. And I apologize, I want to clarify that the links in the PowerPoint, you won't be able to click on those directly from Zoom. But when you go to the Awareness Day website to find the copy of the slides after this presentation, you'll be able to click on all of those links and find the resources there. So the first bill that I'm going to cover is Long-Term Services and Supports Case Management Redesign. So for those of you who've been involved in the IDD system for a while, you're probably aware that we have been having conversations for many years about a potential redesign of the case management system for people with disabilities. And this bill, which is being led by the Department of Healthcare Policy and Financing, lays the groundwork for that redesign over the course of several years. So this bill really just kind of kicks us off in that direction, but it leaves many of the critical decisions that have to be made about this redesign to a robust stakeholder process that HCPF will be continuing in the coming months and years. It is a pretty lengthy bill, but I encourage you to take a look if you're interested. The next one, HB 118, is alternative response for mistreatment of at-risk adults, excuse me. These titles are sometimes, they don't roll off the tongue exactly. So this would actually create a pilot program for an alternate response that adult protective services agencies can use when they get a low risk report of mistreatment or self-neglect of at-risk adults. So it would allow them to explore other less, penalizing options besides their existing full investigation process that they have to use. This is just a pilot program to see how well that works. Next, HB 1097 would establish a behavioral health administration to coordinate behavioral health services across departments. In the recent years, Colorado has invested a lot of funding and resources in our state's behavioral health network. And this is the next step in that process to ensure that there's additional coordination. We know that people with intellectual and developmental disabilities especially tend to fall through the cracks with respect to receiving the appropriate behavioral health services. And that was demonstrated by an excellent report that actually JFK Partners led several years ago called the Gap Analysis Report. So this is the next step in trying to address those gaps. Finally, HB 1122 relates to first responder interactions with people with disabilities. This would create a commission within the Attorney General's office to improve first responder interactions with people with disabilities. As many of you may know, sometimes those interactions can be less than ideal when first responders don't understand how to communicate with our population or their unique needs. So this is the first step to addressing some of those issues. With that, I'll turn it back to Josh to talk about the future of the End the Wait campaign.
Thank you, Ellen. As you might recall, last year, about 500 of us were at the Capitol. We were all wearing blue, and we were all asking our legislators to end the wait. Our End the Wait bill from last year was drafted as a joint budget committee bill, but it also had really strong support from Colorado leadership in both parties, as well as most of the Colorado General Assembly. We also had over 100 agencies in support of the bill. This bill would have ended the wait for 3,000 people that are waiting for residential services on the DD waiver over multiple years and would have invested in IDD provider rates as well. But of course, due to the COVID-19 pandemic and over $3 billion in mandated cuts to the Colorado budget, our End the Wait bill was postponed during last year's session and again this year. In March of 2020, last year, we quickly shifted our efforts to keeping people safe and healthy in the community and asked legislators in the governor's office to spare us from any budget cuts during the pandemic. We are happy to report that not only were IDD services saved during the pandemic, which I reported on earlier and Ellen as well, but the legislature in this current year is looking at funding emergency services, ensuring that we don't have a wait list for the other two IDD waivers, and even proposing a 2.5% provider rate increase for 2021-22. So thank you. Thank you for your advocacy for the IDD community. Your advocacy makes all the difference. And for our state partners and the legislators that might be watching, thank you for protecting our community. We value our partnerships. So even though about 80% of the people, those 3,000 people waiting are receiving some type of service, we do plan to come back next year to ask for the legislature to end the wait so that those people can receive the services they need in the community of their choice. With that, I believe it's time to turn it back to Dana and see if we have any questions. But if you do have questions after the presentation today, Dana will also tell you how you can get in contact with us, and we're happy to respond to those questions via email.
Thanks, Josh. So now's the time, if you have any questions, to put them in the Q&A, and we can answer some of those live now. But we will be putting together a frequently asked questions document that will be on the webinar page. You can also reach out directly to any of the presenters at the emails on the slides that you saw. So Josh, are we going to do some Q&A?
It looks like we don't have any questions, so hopefully we covered everything that we needed to, but again, feel free to reach out to us if you don't have, or if you have additional questions.
Okay,
thank you.
Great. So the PowerPoint and the IDD bills referenced, the bill talking points, and the recording of this presentation will be posted at alliancecolorado.org/IDD Awareness Day. So thank you to the sponsors and presenters, the ARC of Colorado, Alliance, JFK Partners, today's presenters, Josh Rail, who's the Executive Director of Alliance, Ellen Jensby, the Senior Public Policy and Operations Director, and Cristiano Sosa, the Executive Director of the ARC of Colorado. Thank you for being here today.